I feel like a lot of people, especially a lot of, working moms or anything, they're like, oh, I need a Valium. I need a Xanax. Do they really need that? Sometimes.
How shall I answer?
Right. It just seems like it's almost trendy, right? Can I say that?
Yeah, kind of, and that is in a way what I was saying about we almost know too much with what we can Google and what we find on the web. It's helpful to us in a way as therapists and practitioners because people are often correct. They walk in knowing what they have as opposed to, I don't know what's wrong with me, but I haven't flown in 15 years. But they walk in and say, I have fear of flying and I had a panic attack on my last flight and I know that's why I don't fly.
But a real fear, you understand, but with this kind of like, oh, I'm feeling anxious, so I need to self-medicate, seems to be like when back in the day kids would have ADHD, they called it ADD then, right? And every kid in the world was on Ritalin, right? Yeah. And it became so overprescribed. It was, oh, you're bouncing off your chair, you need Ritalin, right?
No, you're right.
So are we seeing a little bit of that in this kind of like modified phobia or modified panic attack that like, oh, it's a stressful day, I need 2 glasses of wine and a Xanax?
Well, I was going to say, how about wine? I mean, I think people think about medicating themselves with a substance that isn't deep breathing or isn't relaxation or isn't meditation. It's easier to pop a Xanax and run home and have some wine or have it in the middle of the day if that's your choice than, but it's a quick fix.
But if you don't need it, what are you doing to yourself?
Wrong. It's incorrect.
Right.
I mean, I will say something about Xanax because it does help people get on a plane. When I'm helping people get over a phobia and something as dramatic as taking a flight. I mean, it's 27 minutes to Key West and it's 45 minutes to Orlando. Those are my 2 first choices. I go with what's called systematic desensitization. You take a short flight before you take a long flight. You pick your poison, 27 minutes or 45 minutes. When you get to Orlando, you have to bring me something from the airport, a Disney figure to prove to me that you were there. Okay?
Okay.
They're ready. They're anxious to do it, anxious in a different way. And yet they still have the fear. Maybe once we'll do it with Xanax and the next time we'll do it without. So 0.25 Xanax.
Okay.
Because often people get on the plane and the first thing they want is a drink. I can't hold my patients to a higher standard sometimes than I can hold the normal population, especially if they think maybe just this once. But it would not be something that I would prescribe on a regular basis.